Good morning and welcome, everybody. My name is Kathy Nowak and I co-chair this committee with Gail Pato. Gail is...
Somebody's got their sound.
Gail is with us virtually. She was not able to come to Albany today. Before we start, I just want to say, well, I think winter has arrived because it's freezing here in Albany. I think it's freezing here throughout the states. And you poor Buffalo people, Western New York and upstate New York with all your snow. So it's probably the first time I've ever had a meeting in December that's been this cold anywhere. So stay warm, everybody. I'm going to do a roll call as we begin this meeting. In Albany, we have Scott Brady. Yes? Here. Okay, Tina Vale. Here. We have Dawn O'Hara. Here. And we have Mary McGuire. Here. We have Alexis Harrington.
Here. Okay, and additionally in Albany, we have Chad Caruso. Nick Hobson.
Here.
And Amy Burdick.
Here. Buffalo. Do we have Karen Elshner in Buffalo?
Yes, here.
Okay. And Ann Scherf?
Yes, here.
I believe we may have a snowbound person, Crystal Vossler. Are you remote? Okay. And Chris Ortega?
I'm here.
Are you here in Buffalo?
Yes.
Okay, thank you.
Hey Chris, just a heads up, there's a little bit of echo and background if you're in the room with other people who are joining on audio.
New York City, Mary Fasano. Mary, we can't hear you.
Here I am.
Okay, and Deborah Greif?
Here I
Virtually, we have Jennifer Goldman. And we have Gail Pato.
I'm here.
Okay. We also have Maria Suchi Kozak virtually. Okay, and I think Maria may have had trouble getting on or will be joining us late. And Aliyah Hussein, are you virtually? Okay, she's not here. All right.
All right, it's Alexis. We've got a few people from OPWDD on virtually. Abiba.
Hi, good morning, everyone. My name is Abiba Kindo. I'm the Deputy Commissioner for the Division of Service Access, Program Implementation, and Stakeholder Supports.
Thanks, Abiba. And we have Christine Carrion.
Hi, this is Christine Carey. I'm the Associate Commissioner for the Division of Fiscal Policy and Management.
Thanks, Christine. And we have Deb Ellis.
Hi there, I'm Deb Ellis. I am the Chief of Staff.
Thanks, Deb. And we have Delia Tucker.
Good morning, this is Delia Tucker. I'm the Statewide Operations Director for the Regional Field Offices and SPS.
Thanks, Delia. And we have Earl Jefferson.
Good morning, everyone. My name is Earl Jefferson, the Director of Central Operations here at OPWDD.
Thanks, Earl. And we've got Eileen Haynes. And we have John Wilson.
Hi, I'm Josh Olson. I'm the Deputy General Counsel, and apologies for no video. I'm having some Wi-Fi issues.
Thanks, Josh. And we have Rachel Baker.
Good morning, Chief Strategy Officer at OPWDD. Thank you.
Thanks, Rachel. And last but not least, we have Commissioner Bear.
Thanks, Alexis. Good morning, everyone. Willow Bear, Acting Commissioner. And speaking of the cold, I got home from traveling last night and my furnace stopped working. So I am home waiting to let them in to fix that. So apologies for not being there in person this morning.
Okay, so with that, Commissioner, please give us your, before we have to give us some of her updates, we're going to go through these slots. Okay. You could go through all the links. People could see what's on the agenda and when it's on. And now, Commissioner, you're on.
Great, thank you. I don't have a ton of updates today anyway. For those of you that joined yesterday for the DDAC meeting, we highlighted the fact that it was International Day of Persons with Disabilities, which is an international holiday celebrating the importance of recognizing people with disabilities. And the theme for 2024 is to enhance the leadership of people with disabilities and to enhance inclusion. And I just wanted to sort of highlight that holiday again. I think so much of the work of this committee really supports our ability to be inclusive and to highlight how many ways people with disabilities can really engage in leadership within their lives. So I just wanted to highlight that holiday again. Is there feedback coming from me? Can you guys hear me okay?
We hear you.
Commissioner, this is Judith Rakovich, one of the interpreters. Yes, it's a little staticky. It's a lot staticky.
Yeah, that's what I was afraid of, just to make sure everyone else is muted. I don't hear the static now, so maybe we fixed it. So just in terms of updates, advocacy, right? So we've talked about advocacy at the last couple of meetings. So 3 small updates in that world. We've talked, I think, previously about the idea of peer specialists. So that is the civil service title for people that have a developmental disability but work within the OPWDD system to help provide advocacy on behalf of the state agency. So we have now onboarded our first team of peer specialists. So that's 6 people with IDD who work for the commissioner, who do advocacy with peers and families, and also on behalf of the commissioner, review draft policies and draft messages to make sure that we are communicating in accessible language and graphics that make sense to people. And just acting as an advisory body for the commissioner's office and for the agency overall. So I'm really excited to have that team in place, and we highlighted them yesterday in a commissioner's announcement. We also, early in the new year, will be onboarding our new director of advocacy. So that person will oversee that team of peer specialists. We'll also liaise with all of our different advocacy groups. We'll work with the statewide ombudsman contract and the ombudsman that oversees our developmental center. So sort of bringing all the advocacy into one place so that I, as the commissioner, can have sort of someone to collect all of that advocacy feedback so we can really think about what strategically it tells us about what we need to do as an agency. So very excited about that. We also, by the end of this year, will be announcing the formal launch of the statewide ombudsman contract. So I know that people have been very excited. That should be publicly announced very soon with the website, the phone number, the education materials, and they should be ready to start receiving calls any day now. So very excited about all three of those. Our strategic plan update will also be released potentially as early as this week. So, you know, we are midway through our 5-year strategic planning cycle. We release an annual update in the winter of each year. So that's what's coming out soon. There are some changes this year in how we did the annual update. So we hope that people will find the new format a little more sort of reader friendly. We have a lot of informational graphics in there, some data, and just some more sort of concrete details about things that we're working on. One of the other differences is that in this year's annual update, we decided we needed sort of a short-term housing strategy. So strategic planning in the 5-year sense has a lot of long-term planning about what to do in various sectors of the service system. But what we were hearing over and over again in our various forums and stakeholder meetings and FSS and DDAC was the need to really have some quick action to sort of sustain housing services, particularly certified housing services. So what we did as a team, as a leadership team, was review sort of all of those comments that we received, all of the recommendations we have received, really thought about what types of projects we could complete in a relatively short time period. And for the state government, we decided that was within 12 months. And what would have the biggest immediate impact on sort of sustaining the system. And so what we have in our strategic plan update is very concrete projects that we are committing to complete within the next 12 months in the area of housing. So it's things like our capacity management infrastructure that we have talked a lot about, reducing administrative burdens that our residential providers engage in, excuse me, creating more educational materials for families about what the different types of residential options are, what they look like, how to access them, and how to use our state operations as like a safety net provider for more complex people who our voluntary providers have a hard time serving. There's a lot of information in the update that you all can look at, and certainly we can talk about if there are questions after that's released. So we're really excited about moving forward with that update, and I hope that people like sort of the new format that we've worked on. And then of course we have a lot more long-term planning in both non-certified and certified housing. Sort of what changes do we need to make on a long-term basis, particularly with respect to aging infrastructure and a population that's aging, right? We know that there are some changes that are needed in how we think about how we serve people who are aging in place and how we can better meet the needs of an aging population. And in the non-certified world too, a lot more thinking about how to maximize people's ability to live on their own, right? And less reliant on certified housing. So much more of that to come. And the housing strategic plan is not meant to capture all of those things, right? What else was an update? We have our self-direction and CCO evaluations ongoing. So those are independent contractors reviewing care coordination organizations overall and the work of care managers. They've done a lot of outreach to folks to understand how everyone is experiencing the service of care management, to make recommendations about how we could make some changes there. And similarly in the world of self-direction. So I know that a lot of you are probably engaged in those sets of feedback and really excited to see what those consultants come back with next year in terms of recommendations. And then I think the last thing I wanted to highlight was just the next phase of our collaboration with Georgetown's University for Cultural Competence, which is a set of listening sessions for family members. So I think that announcement went out, and so folks could sign up to participate in a listening session with Georgetown University to help us really get a better idea of everyone's experience with having access to services or no access to services or limited access to services, and sort of how the experience of receiving services as a family member, what that has been like for folks. So please look for that announcement and try to join one of those listening sessions so we can get that feedback. And I think that's all the updates I had for now, unless there's any questions. All right, thanks so much, guys.
Does anybody here have any questions or okay, Jan?
Yes, I was just at the peer specialist, the state employees and their advocacy for peers and families. Will any of them be participating in these statewide committee meetings?
Yeah, I think that's a great question, Jan. We've been starting to incorporate them into more of the work of the agency. And certainly having them at least participate and listen and be available as part of the process, I think is a great suggestion. And we did not invite them here today, but we'll make a note of that. Thank you.
Any more questions? Okay, well, I think that's it. Thank you, Commissioner.
Thanks. Stay warm, everybody.
Okay, now we'll have Chad, if you could give us the OPW updates.
Is that working now? There we go. Great. Thank you and good morning. This is Chad Calderuso, and we're going to jump right into our updates. And the first thing we want to talk about is the local advisory council reimbursement fund guidelines. Next slide, please, Norm. Okay, so I know this is something we've been working on for a while, and we are now on the brink of having this released. The good news is the new guidelines will be effective for January 2025. So we will have the full guideline document released to you before the end of this year, hopefully very, very soon, along with a form to help facilitate it. But this will establish consistent approaches to enable spending for local advisory councils for expenses directly related to executing the duties as members of those councils. Next slide, please. So what you'll see in the updated guidelines, or the new guidelines, will be a non-inclusive or non-exclusive list of items that are eligible for reimbursement. This will include things like costs related to actual meeting space. It also covers care for a dependent family member. Though we do want to emphasize that for that kind of service where OPWDD funds via Medicaid respite or others, we'd expect those to be used ahead of the local council reimbursement guidelines. Also travel and transportation costs for meetings. And that would be consistent with the already established travel guidelines, and the PowerPoint slide later does have the travel guidelines link, which is posted to the OPWDD website. Would also note that with both the care and the travel items, that will cover site visits as well as ongoing meetings. Additionally, explicitly allowed items include the cost for virtual meetings, so things like a Zoom license or other software that might be needed is allowable. We are expecting that in general, where viable, those fees will be one account per council. If there's need for individual accounts, that would be something that would be reviewed at the local RFO. Next slide, please. Okay, so continuing on with the list of allowable reimbursement, includes things like, again, for software electronic survey tools, also office supplies or postage are allowable costs. Items that facilitate meetings, hospitality items, so really that's the reasonable cost for food or beverages. And for reasonable cost, we're putting a cap on that at $20 per person per meeting. And also additional expenses for outreach, so any mailings, brochures, any signage, all of those things can be funded within this allocation. Translation interpretation services are included. And additionally, if there's additional expenses for a member to participate in trainings or conferences, those fees can be funded as well. Next slide, please. There's also a short list of items that explicitly are not included within this allocation. And again, this is not meant to be an exhaustive list, but just to provide some examples. Anything that's not directly associated with the actual local council business or duties would be excluded. Items or services that are intended for personal or private use or benefit of a member of their family would be excluded. Likewise, things like luxury goods, gifts, gratuities, and excessive expenses. So things, that where costs are beyond what would be typically afforded for a good or service. And once again, that's not an exhaustive list. In every scenario, it'll be the regional field office, FSS coordinator or coordinator teams who will be looking at and reviewing these requests for reimbursement. Next slide, please. Okay, so the allocation is $3,000 per council per calendar year, so that's January through December. It's going to be a reimbursement-based received model. So reimbursement will be based on having documentation that identifies and supports the actual expense when it was purchased. There is a clause in there that will allow direct OPWDD purchase where reimbursement is prohibitive due to financial constraints. So that's again something that would need to be reviewed and approved at the RFO FSS team level. And any direct reimbursement would also count against that $3,000 annual allocation. Should emphasize the point that there's no carryover, so it's $3,000 per calendar year, and that's it. The next year will be $3,000 regardless of if the full allocation was spent in the prior year or not. And the expectation is for the documentation to be submitted no less than once per quarter, assuming there are expenses, but also no more than once per month to just keep those expenses in the background to be reasonable. And central operations is going to take over in a little bit and provide a little bit more information about exactly what that reimbursement will look like. Next slide, please. And just to repeat, this will all be facilitated through those OPWDD regional field office, family support service coordinator teams. And of course, any travel goes with the already established policy guidelines. So with that, I'm going to turn it over to the central operations team, or ONT, to talk a little bit more about the vouchering process.
Great, thank you, Tad. Good morning, everyone. As I mentioned before, my name is Earl Jefferson. I'm the Director of Central Operations. Also on the call with me is Elizabeth Baker Johnson. She's our Assistant Director. Central Operations is the primary payment arm for the agency for local assistance service payments. I think with this, what OPWDD is doing is we're really centralizing the payment for these reimbursable costs and services for the local advisory councils. So what we're really doing is just we're going to be making the payments centrally from from Albany, out of central office, from our division and our bureau. There still will be a local presence in terms of information going to the local family support service coordinators. I think the expectation is information will flow through them. They will just verify that everything is in order and meets the qualifications, and will be forwarded up to Albany for us to process the payments. So really, this is just a way for us to centralize processing these payments. It will enable us to track the expenditures and make sure we're staying within the $3,000 yearly annual limits that are in place. But it should flow very, similar to how things are working today. It's just really changing how the payment is being processed. Chad alluded to this. We're kind of following what we do with all of our other service payments in terms of making, payments once per month. We for our providers, we expect reimbursement requests to come in after the first of the month when the dollars were expended. So if we start in January, qualifying expenses that you're able to access for January would be payable by OPWDD once we get past February 1st. But again, the expectation is that information will flow through the local FSS coordinators. It'll be reviewed. It'll come up to Albany for us to process and make the payments, and we'll track it. And that way it'll give us an idea of where the councils stand in terms of the dollars that are being expended and keeping them in within the $3,000 annual limit. Really, that's all that I really wanted to touch on. Chad went through a lot of the guidelines. We do have the draft guidelines that will be coming out when we get, closer to implementation for January. That'll have a little bit more information in there. But I don't think we're talking about anything onerous for the councils in terms of getting the reimbursement. It's just really centralizing and OPWDD tracking and making payments from one source instead of various business offices throughout the state. So with that, just wanted to touch on a couple things, but obviously more information to come. And with that, Chad, I'll turn it back over to you.
Okay, thanks, Earl. So that kind of wraps up our section on this. Do we want to take questions now, or okay?
Okay, I see that Chris Palega has his hand up. Chris?
Hello, can you hear me? Not coming through.
It's unmuted.
I see it on my screen. I don't know what that is.
I
Hello,
can hear you. This is.
can you hear me now?
I can hear you.
Very good, yes. Can you hear me now?
Yes.
Fantastic, thank you. Yeah, so I glad to see this is coming in for a landing. It's been a while working on it. Thanks so much. I wanted to put the idea out there of the possibility of perhaps also establishing a budget for the Committee on Family Support Services for our body. There are, expenses that we might want to think about down the road that don't necessarily come out of a local budget, or would be kind of simpler to be able to do from a centralized committee budget. Things such as, maintaining a website for the FSS committee, and again, survey instruments that we might want to use on a statewide basis. So I just wanted to, something we've talked a little bit about in community engagement. I just wanted to put that idea out there and see what thoughts were on that, and if it's something we might want to talk about in the future. Thank you.
Hey Chris, can you just clarify, it's Alexis, I want to follow, are you talking about like in addition to the 3,000 at the local council, that there would be another set aside dollar amount for the work that the breakout groups of the statewide committee, so like you're working on the advocacy committee, is that what you mean?
Yeah, I mean, I was thinking more generally, you know, for the committee itself, not necessarily break out groups of it, but I could certainly, in hearing you say that, it makes sense that that would be included in it. I'm just, you know, for instance, the simplest example I can think of, say the committee wanted to have our own website so that we could then have our public facing, you know, presentation and establish our presence online and try to use that for engagement. It's going to be difficult to fund that through allocations from 16 different local budgets. If we had a centralized statewide budget, it would be very easy to account for that, to, you know, make sure it's, you know, we're spending the money properly and so on and so forth. Again, it's just an idea that has been kicked around, and thought I'd put it on the table.
Thank you, Chris. That clarification helps a lot. Let's take it back and see how we might be able to figure out how to make that a more centralized process. Now I hear what you're saying. And sorry, we've been trying to mute ourselves so that there's not additional feedback. So we've been talking, but you haven't heard us. So yes, we gotcha. I hope you heard that okay.
Yep, thank you.
Scott in Albany has a question.
Sure, thanks. This is great, appreciate it. So the approval process should be by approval from the at the local level, because we don't want to submit something and then not get reimbursed, right?
Yeah, I mean, that's a really good point, Scott. And we didn't write it to explicitly mandate prior approval, but I think that's always going to be the best practice.
Yeah. So the second thing is the translation issue. I want to know if we're required to provide translation services. We're not a government body, but, and I don't know if anybody ever came across this, but it becomes pretty expensive. So it becomes very expensive very quick. So if we have somebody who doesn't speak the language or maybe deaf, those services become expensive because they would be coming to recurring meetings. And they would eat up $3,000 pretty quick. You guys know that, in the translators here, right? So I just think we ought to consider taking that out and finding a way to if OPWDD thinks that's important, then we ought to find a way to fund that appropriately and not through a $3,000 limit. So if we ran out of money in July, would we tell those folks that can't attend? Probably not, right? So I would ask you to reconsider that expense. That's a local expense.
No, that makes sense. Do you know, is that something that's currently, you know, we need?
Not my region, but I know that if it does come up, we would scramble to figure out, number one, how to get a translator, how to get those services, and then the cost. You know, cost is outrageous. It's important, but it's very expensive. Mary, you've had that, right? You said.
What we have, Chad, in the metro region, in having, you know, offering translation requirements. I mean, offering translation for a meeting and having people sign up and then not having them attend the meeting. So you have a translator there, and it would be anywhere from $200 to $300 for an FSS meeting to have a translator. But again, we really should provide that service for everyone to be allowed to attend and understand what was being said. So it's a good point. Thanks, Scott, for bringing that up.
I appreciate you raising that. I'm also wondering if maybe the FSS statewide committee wants an additional kind of committee focused on making sure that we have that diversity, equity, and inclusion lens throughout everything we do, to maybe talk about it a little bit further. But I totally hear what you're saying, Scott. I think we'll have to bring it back and just understand what those actual costs are looking like. And it's been a bit since we've been able to kind of put something in place that's consistent, right? So this is our first kind of attempt to try to do that.
Thank you for that, Alexis. And Gail, I hope you're taking good notes. Because this is something we will bring back to the entire state bar. We know New York City has their hand raised, so let's ask Tina, but she has hers raised here as well, to speak first.
Hi, thank you. I just wanted to find out two things. We have an agency now that we get our funding from. So will we not have the agency anymore? Will we be working with the state office to do this now?
Yep, exactly. We're looking at helping making that transition for that specific council area.
Okay, on that note, Chad, our calendar year in district, area 4, region 4 is, we end our calendar year on July 30th, so the agency that have. June 30th. Sorry, I don't know my dates. June 30th. So how will you do that? Just to be aware of that. Our money is allocated different, so we don't start on the first of the year.
So this is gonna be a new process where everybody who's accessing the $3,000 at the local council level will be accessing it January to December 31st. So that's starting January 1st of next year. So you don't have to worry about that contract that you're talking about that you're currently under and accessing through. That's gonna go away. And then everybody's gonna align on the same actual calendar year versus a fiscal year or versus a contract year.
So we will keep our contracts till June 3rd.
No, you're gonna switch.
Okay. So if people did spend their money already, do they just access the balance?
So we'll work with New York City specifically because I know that you are all doing a different process right now. So until we issue the guidance, just keep doing what you're doing. But spend after January is gonna be gone through this new process. So keep doing what you're doing now and we'll work with you one-on-one because we know that you have a unique situation.
Okay, New York City has a question.
Okay. Now, the other issue with the agency being our fiscal intermediary, they took the admin rate. So what are we supposed to do about that?
Yeah, so don't worry about that. We'll figure that all out offline. You don't need to worry about that, but we will be working through a centralized process starting January 1st. And it'll go through a calendar year moving forward. So, no worries about that.
And one other question, Alexis, I'm not talking, if we're having miscommunication with the agency that we're working with, we can just work for the moment with our local FSS coordinator to straighten it out now before December 31st.
So if there is anything that is spent before January 1st, keep doing the same process that you've been doing. If anything is spent January 1st moving forward, then you would be working with the FSS coordinator, and that's the process that we just outlined. I hope that helps.
Thank you. I'm just trying to make sure I heard you right. Thank you.
Any other hands up? I have a question. Have all the 5 boroughs, have the agencies been notified? Well, it will be today or tomorrow. Okay, next. And we have the RFP timeline, for our statewide members. I will update you. This just came in after I sent you the email with the breakdown by dates. And Alexis is going to report on that.
Thanks, Kathy. All right, so there has been a ton of work done by this group and others who are not on at the local council level. The statewide committee has been focused on really making sure that we're able to resurrect the RFP process. So what we have also been doing is just working on that formal RFP, template and all of the relevant attachments. So these are all under review by OPWDD right now. There will be future engagement with the RFP committee to discuss the scores for the RFPs, as well as reviewing the template and the scoring template. And we'll be discussing who needs to be trained on the scoring template, and all of that good stuff. So I want to share with you all right now, as of today, really highly emphasizing today at 11:48 a.m. We have a tentative schedule as follows. So we are planning to issue the RFP late February. We would be training the RFP scorers in mid-March of 2025. In mid to late April, the scoring of the actual applications would begin. And then in late May, the contract approvals would be announced. And then there's, of course, the New York State Comptroller's review, and then final approval of the contracts, meaning that they're fully executed, would be up to 90 days after that. So I'm going to pause here and see if there are any questions about that before I switch gears to the site visit protocols.
Hi, Alexa, it's Mary Weaver, from Manhattan. I just wanted to make note to the, that, Manhattan is going to do our, program evaluations so that, and it will run into, February and March. So I just want them to be, that I need note of that. Thank you.
We also have a question. So the 5 boroughs, again, Region 4, their fiscal year starts July 1st. Will that continue? Because if we're going to have late May contract approvals announced, and OPW contracts up to 90 days after, that's going to go past July 1st. Or are you going to make your DDRs work 24 hours, 6 days a week to get the 5 boroughs contracts out? July.
So with every good thing, there's a negative, right? So we're going to be issuing the RFPs, and it's not going to be aligned with a typical contract year, right? So I think you're calling out a good point here, that it isn't going to align. It's not going to align with upstate, it's not going to align with downstate, but that's just one of the outcomes of us being able to do this process. So it will be an adjustment, but we will work with all parties to make sure that all understand the timing of that.
Great.
So it's just these contracts that are awarded through this RFP process that are going to be on an off schedule. Does that make sense?
If they go out, if everything's finalized by September 1st, then these particular contracts are going to run on a September 1st to August 31st. Okay. I saw a hand raised. Is it still up? Okay. All right. We can move on to our next topic. Updates to site visit protocols. Is that going to be Alexis?
All right, so this is another one that we have been talking a lot about and really trying to make sure that we are utilizing a consistent process moving forward. So everything I share today is the things within the guidance that we're reviewing right now, we will have additional conversations with the statewide committee to kind of confirm what this guidance and what the protocols look like, but I wanted to share with you what we're contemplating and what is being discussed right now. And there are some great conversations happening within our agency across the regional field offices to ensure that we are able to do this consistently moving forward once we finalize that guidance and issue that. So what we have been focused on is really drafting procedures that are specific to the site visits. Some additional guidance on contract reviews, annual survey requirements are also under consideration. Like I said, we're trying to make this very standardized across the state, increasing transparency and better involving local advisory councils in the process. So next slide. So what we're going to include guidance on the FSS site visit protocol will be the frequency of the site visits. So we'll need to note something related to the site-based programs that really should not occur any less than an annual basis unless there's a program performance need that dictates otherwise. Visits to non-site-based programs would not be required in person at the discretion of the regional field office, and additional consideration to the frequency of site visits based on meeting contract expectations. So I'm going to go through these slides. I don't know if anybody wants to kind of discuss what we're raising for each of these points, or if you want to wait until the end. How do you want to handle that?
I think wait till the end unless anyone objects. Okay.
All right, I'll keep going then. Next slide. Oh. All right, so another thing that we're focusing on is the site visit format. So we've heard there could be any combination of in-person, remotely, or a combination. We are going to land on a consistent approach that may have some kind of hybrid, might go back and forth between in-person and remote. In terms of an official visit, and official meaning that we have at least a regional field office staff person on site. Those visits would occur at a time that's convenient to all involved and would optimally involve at least one local advisory council member. So that was another thing that we had heard. These visits might not be happening when you all would be able to attend. Next slide. And then in terms of the site visit responsibilities, I think everybody knows that it is a contractual obligation, and these are the responsibility of the regional field office to routinely complete these site visits for eligible FSS providers. The local advisory council members would collaborate with the regional field office to routinely assess overall providers within various domains. And at least, like I said before, one member of the local advisory council will accompany involved the regional field office to the site visit, and exceptions could be considered as well. Next slide. And then again, like I said, the official site visits require an OPWDD staff to be present. Council members should prioritize visiting FSS agencies or programs located within the county they represent. However, council members may visit any program or agency operating throughout their district. That's completely up to you, but we encourage you to attend ones that are in your county of residence. And then council members should not attend an official site visit within that capacity for any agency or program which they are affiliated with. So that would be, something that's noted in your conflict of interest form. And any identified or observed health, safety, or welfare issues must be promptly reported and reconciled per New York State Mental Hygiene Law, Part 624, 625 protocols. Next slide. And then in terms of records and documentation, so we are working on a newly developed comprehensive FSS program evaluation checklist. And that's what would be required to document the site visit finding and observations. The regional field staff should be providing access to various FSS provider and FSS records during the site visits. These requested records may include, but not be limited to, FSS staff training records and clearances, annual satisfaction survey findings, and individual records and related plans. Fiscal records and required documents, as relevant, may be requested and viewed separately during the site visit. And this checklist that I mentioned before will identify any recommendations for the FSS program based on the site visit findings and the records review. Next slide. All right, so before I kick it over to Nick, I just wanted to see, were there any questions about that at all? We do have a point to talk about data sharing in just a little bit. I know that has been a point of conversation as well, but any questions about what we talked about related to the site visit protocol so far?
The only question I have is this comprehensive checklist. When can we expect that?
So you can expect that when we have the proposed guidance, we'll have both for your review. So we'll walk you through both the proposed guidance before it's finalized and the checklist. It'll be a package deal. Oh, well, soon. I would say we're finalizing the edits from the regional field office at this point, but we want to have a conversation with you all before it's final. So you're going to see it in the next few weeks, I would say.
Okay.
And just before Nick goes into the FSS, oh, did you have a question, Scott?
Yeah,
Okay.
just a quick comment. So we're going to talk about data. It's very important. This is great. But I would also recommend, since we've been, I'll speak for my region, but I think most have been out of the loop probably since COVID. Yes, right. So we have our group. But it would be important for me to also understand previous evaluations, site visits, and the issues that came up. So my understanding is that there are recurring issues that aren't always dealt with. And the question is always, should we be funding programs that have recurring issues and ignore, advice and issues raised by the coordinator and the council? So anyway, I would add that if you could.
Thank you, and I'll actually capture that in our data conversation, because it'll be more of a discussion, like, what are we missing? So that, we'll add that to the list.
Okay.
Thank you. And Gail, I think you have your hand up too.
Yes, thank you. I heard you mention that one member of the council should be in attendance, and that's wonderful. And that it's encouraged to stay within your own county, but we do have some counties that don't have representation. So I understand that we can attend site visits in other counties. I'm wondering if it's still mandatory that a council member does that, or even counties that are not represented on the council. I would like to see that, I guess is what I'm saying.
Yeah, Gail, is that something that you would want us to write into the guidance, like as a requirement, because we could absolutely talk about how maybe the local councils that have less coverage, maybe there's an exception where there's an expectation others will be attending outside counties of residence for site visits. Is that what you mean?
Not necessarily a requirement, but that it's still, if we still need to ask members if they can make it, rather than just having staff do it independently.
Got it. Okay, yes, that makes sense. Thank you.
Thank you.
New York City?
Deborah, Alexis, one issue that there has been is that we need to make sure that the advisory councils across the state, can you hear me clearly?
Yes.
Okay. We have to have updated IDs that say we're parent advocates, because we're members of the council, because you know, because of COVID, many of us couldn't get our IDs updated. And it's important because when we do the site visit with OPWDD, we should have correct IDs to go in and out so they know who we are. Because, Alexis, I have been told by agency people, who do I think I am? You're not supposed to be here. My former coordinators had to straighten them out. I don't want to go through that again. So I'm asking, can we please see that the IDs are updated, and also the agencies have to realize that this is in their contracts and that they shouldn't look at us and say, what are you doing there here? It has been said to all of us. Thank you.
This is Aviva. Let us take that back, because I think if council reps are going out on the visits with, you know, the FSS coordinators, right? They have their OPWDD ID, right? And can certainly vouch for the folks that are with them. So let us just take that back and just have some discussions on that. Thank you for raising it.
No problem, but I will be taking a picture of my ID and emailing, so you'll see that it's outdated, okay?
Okay.
Question?
Krista?
Hi, kind of along what Gail was asking, we do definitely need to have that exception for areas, because I live in Allegheny County, but we cover Cattaraugus, Chautauqua as well. And we do not have anybody on the council that are from those two counties, even though they have a higher population than we do in Allegheny County. So we definitely need that exception. And I was wondering, because I saw that you had an exception for agencies, or it was program/agencies. And for our Special Olympics, that's ran by Allegheny Steuben Arc. And so even though my son's not in a program that's Allegheny Steuben Arc itself, they're running the Special Olympics program overall. So I put it down as a conflict of interest. However, they have 3 programs that are actually agency ran. And I was hoping that there'd be some kind of exception, instead of saying agency, if maybe it could be a program, because my son's not involved in any of the 3 programs that they have. And I would like to be able to attend those reviews, because we're not associated with that in any way. We're just having our children in Special Olympics.
Thanks for raising that, Crystal. I think what we're gonna do is, once we have an updated version of the guidance and the tool ready for a review of the statewide committee, we'll convene a meeting, kind of walk through that and just flag some of these areas that you're mentioning. I think we just have to have a conversation about these kind of specific situations and conflicts of interest. So I think that meeting might be the right place to do that.
That sounds great. Thank you. I appreciate it.
Jan, you have a question?
I just wanted to reiterate what Deborah said, because I think this is an example of the disparity between New York City and Albany. For a long time, there's been requirements of ID in New York City venues. And it's important to respect that and understand it's important for the committee members to have that.
Thanks, Jan. All right, you got it.
I just wanted to go back to when you have emphasized that you understand the importance that it's convenient to all members, at least one member to attend a review. We do have many working families that work 5 days a week, many who are statewide members, as well as the council chair. And the state workers work past 5, is it virtual going on? I mean, what's the expectation? It has to be some kind of flexibility, and I think we should have a discussion about it. I'd like to know your thoughts on it.
Yeah, I mean, I think that is something that we should bring to that meeting because, you know, how do we define having a convenient time for everyone? Is something we should have a further conversation. And so I hear you.
Okay, thank you.
All right, so I'm gonna turn it over to Nick. Before he goes into his updates on the ADM and some resources that have been made available, I do just want to put in a quick plug as a thank you to those who have been engaging around the conversation related to paid caregivers. There will be a topic covered later this afternoon, which I'm looking forward to, but a big shout out to Chris Palega, who has really been leading the charge related to advocacy. I think that we have had some really great conversations around potential solutions related to the paid caregiver issue and accessing FSS family reimbursement. So just wanted to say a quick thank you before we go into some updates about resources. So Nick, I will turn it over to you.
All right, can everyone hear me all right? All right. Once again, I'm Nick Hobson, the FSS statewide coordinator. I'm going to go through some ADM related materials that we've been working on. As promised, we have recorded a stakeholder training on updates that were made to the FAQs and the allowable and non-allowable list that was issued back in June. That training will be available soon for everyone. So once it is available, as I always say, we'll make sure to let the statewide chairs know and our other various stakeholders, so everyone can take a look at that. That training in particular was to provide some insights to the changes that were made, obviously, to both the FAQs and the allowable and non-allowable list based on the family reimbursement ADM. And like I said, that will be available on the OPWDD website. We can provide some additional overviews and technical assistance upon request. As always, we have the FSS shared email addresses that are available, whether it's the central office one or the ones for the various regional field offices, as the ways to reach out to us if there are questions regarding that training. And additional FSS reimbursement processes and policy issues that were captured through the provider surveys that we did between this year and the previous year are still being looked at and under review by OPWDD. Next slide. Continuing the other documents that we've been making updates to include the instructions for the family reimbursement application. We took feedback from the regional field offices as well as statewide committee members and the local councils to develop that. We are in the final stages of finalizing that document. We have received some additional feedback from our regional field office, FSS staff that we're taking into consideration. In addition to that, I do want to stress, which I think I've said on a couple previous meetings, the application itself is unchanged. These are just instructions to accompany the application to hopefully make it a little bit easier for particularly care managers or the families or whomever is actually filling out the application. And our overall goal really with all of these clarifications we make is to just provide clearer guidance around the application and any of the other supporting documents as they pertain to the ADM. Next slide. And this, again, are some of the things that I think we went over at a previous meeting, but just to once again stress, we have also made updates to the family reimbursement tracker and the instructions. Most of the changes on a very high level, we're removing several columns, which we have listed there. I won't read them all off to you, but when we took a look at that and feedback we received from various parties, we realized these were duplicative and unnecessary or captured in other ways. So we removed these to make that tracker a little less, have a few less columns, a little less information everyone has to be sending between providers and regional field office staff. And the instructions that go along with that also align with what's in that, the changes that we made to the tracker. That's all I have on those points. Like I said, once everything is available, we will make sure to make everyone aware of where they can find that. Do you have any questions regarding those items?
Yeah, we're going to.
Yes, is that a question? How does that's a normal feedback there?
Jen, did you have a question?
All right. And I'm gonna turn it back over to Kathy right now. Thank you.
Okay, so now we're just gonna talk a little bit about the annual satisfaction survey. At our last meeting, we had a short conversation about it, and then, you know, some of us didn't quite, see the newest one. Some of us haven't seen the actual survey in quite a while. So we asked Nick to talk about that. Alexis, to talk about the annual satisfaction survey, and as you can see on the agenda, well, the first thing is let's talk about it. And we also talked about at our last meeting, adding to the survey, if you want more information about FSS, please indicate below. And these are satisfaction surveys that each program is supposed to send to their people who are supported by each and every their support program.
I'm sorry, I switched off the mic on myself. So in terms of the satisfaction surveys, I'll take a quick step back, since some of the things that we've done around the survey were probably done before some of us were in this room or up there virtually. I would say 2 years ago, give or take, we took a look at the annual satisfaction survey, and we had a work group with some of the statewide committee chairs and some of our FSS staff at the regional field offices. Sure, some of you remember the previous survey was done on a very program specific basis. So there was the same set of questions based on different program types. So potentially a family could receive several of what looked to be the same survey, but it would be based on the programs that their family member actually attended. So to consolidate things and try to make it a little bit more simplified, we took that and made it into one survey. So that once again, people weren't getting survey overload. There was some tweaking of the questions themselves too, but that was posted, I believe, back in 2022 now. And it's on the website, and it's an attachment to the family reimbursement ADM. So I know there was, and Kathy and Gail pointed this out to us, some confusion that this survey is meant for all FSS programs, not just family reimbursement. But since it's an attachment to the ADM, we needed to place it with all the other attachments for the ADM. So we can, again, share out the link so everyone knows where we're talking on the website, but, for everyone's knowledge, it's attachment E, as part of the ADM where you find the survey and then you have it in. Someone can tell me how many languages. I believe it's about a dozen different languages. Perfect, thank you. So everyone can see that. So moving forward to today, we have heard from everyone that there's some things that would make that a little bit more useful, and one being this contact information piece. We do know, I think this was something done, with these prior versions of surveys, that there may be a sentence or two about how to reach, we'll say, someone at the local field office, or maybe someone from your local council if you wanted more information. We didn't want to have something like that on this statewide survey that's meant for everyone. And Kathy and Gail, I guess you could step in. I know that there was talk of your recruitment brochure and how we might be able to package that together. Is that something that, I don't know if you've discussed more?
So when Gail and I, met with central office, this came up about the survey and the request to put that asterisk on the bottom, asking if you want information. We just had a conversation, and actually the suggestion wasn't a bad idea, but we're here to talk about it and find out what we all think would be the easiest and best way to recruit new people or get new people. And one of the things we're proposing, we're not saying we're not gonna have that at the bottom of the survey, but I'm not sure, maybe it was, well, what's this here?
Oh, yeah, so I thought it just might be a little bit confusing if we add something not related to the survey itself, and thought maybe if we were able to add in the brochure to complement the survey, that might be, separate and distinct enough, but allow people to express interest. But this is absolutely up to each of you, and so I just wanted to kind of have a conversation with y'all. It's just an idea that I threw out there.
Mary's jumping at the bit.
I'm sorry, because I absolutely totally disagree. I think if the survey is going out on any FSS contracts and we're representing families in those contracts, and a family member is actually either satisfied or dissatisfied, and have the opportunity to have those two little lines on there to say, would you like someone from your local council, advisory council, contact you, and they have the opportunity to say yes. I think we should give them that opportunity. And it also gives the councils an opportunity to expand their family membership. I mean, I can go on about like how we need to involve families, and we used to do that at the front door. We used to go to the front door, we used to say like, this is our council, please join us, we're here for you. And I don't want to lose another avenue to reach families. I don't, so that's my 2 cents, thank you.
Scott?
Yeah, I agree, Mary. I think that any opportunity we can. I also want to know what happens in the surveys. I get different information from my FSS coordinator and from people in the group. So all these surveys are filled out, then what happens? So if we're gonna put information on the bottom, somebody checks a box, where does the information go that we can access it to say, we got 10 people interested?
So, well, start this by saying this process is not uniform. That's why we're having this discussion, but what should happen is the surveys And I know some people are probably going to tell me this isn't exactly how it happens, but it comes from the provider, or it ends up going back to the provider and then should be shared with the regional field office staff. From there, I think there is a disconnect between there and being shared with the local councils. And that's part of what I think we went over. I think maybe that was part of Alexis's updates when we got into some of the site visit stuff. So I think there's more to come on that piece of it.
Yeah, I'm actually thinking maybe we should move to the next slide.
Okay.
Because we can kind of lump this all together. I think we're really getting ahead of ourselves on the data sharing. So maybe I should just cover this and then go back to the conversation about the surveys and the brochure and recruitment, but related to data sharing. So we are committed to having this consistent process starting the first quarter of 2025. And the data that we'll be sharing at the regional field office level will include, at a minimum, the provider data to include milestone achievements, the FSS annual satisfaction survey results, and contract utilization. So there you can see some part of the annual satisfaction survey, but we would need to have a conversation about mechanics in terms of if there is something added to the survey, how does that get back to the local council so that they know who is interested in being contacted? And I think because I don't fully understand how that mechanism would work is another reason why I suggested putting a brochure in as a separate thing with the survey. But I am not wedded to anything. I just wanted to have a conversation and see what kind of works best for everybody around this table and in virtual world.
Chris, do you have your hand up?
Let me undo it
Okay.
there. Oh, now you're set.
Yeah, I just wanted to, agree with Mary and, if we're going to have a broad distribution of a survey, it would be amazing to tack on, if not the brochure itself, at least some opportunity for someone to say, yes, I would like to have a little more information to join. It'd be, I think, an exceptional opportunity for a broad distribution for us. Thanks.
Hey, Chris, I'm wondering if possible that scan code, Q code, whatever it's called, QR code, that we have on the brochures, if we could use that and of course we would have to talk about if the work was too much. You might get responses because that's easy work. But then again, we wouldn't know until we tried it, and I'm just making a suggestion, like, not asking you to do that.
Yeah, I mean, if you're going to print some kind of contact information or anything you're going to printing the QR code is just the same as printing anything else, and we can redirect that QR code, to whatever application or information gathering, piece of survey that we'd want to. So yeah, a QR code is easy to include. We could include a URL if people want to look it up online as well.
Because I'm thinking, I think it was Scott who just said, like, where does that go? And I suspect once those surveys are done and gets to the DDRO, that's another task for the DDRO person to write out something. And is it really going to happen? It's not because I don't think they'll do their job, but it can become a larger workload. I mean, if we were sure we were gonna see the survey when we do reviews, then we could see that on our own. I think.
Yes.
I think what I'm hearing, so far, that people stand by Mary's point of view. And, I mean, we could take a vote on it, but I think it's something that most people aren't, will have to see. Okay. But if everyone is in agreement, then I think that code, QR code, would be very helpful.
Yeah, and you're kind of breaking up on me, Mary, but I think what you're saying is that if we can include the QR code, and we could also include the statewide email address, statewidefss@gmail.com, that would take the burden of all the follow-up that associates with that and put it on the committee as opposed to having to filter it through OPWDD. So even though it's on the bottom of their survey, they wouldn't have to deal with that information. It could come directly to us, and then we could begin to take it from there. And the assist would be the distribution and not the operationalization of the response. I think it makes a lot of sense.
Let's hear from Crystal and then we'll just come back and make a summary of going forward. Crystal?
I can make a special edition of the brochure where we have a line that says to contact your local FSS council member, have a special code for that or a line for a URL. And then I could have the line that we have currently on the two brochures that has to become a member, that they can go click on that link or scan the QR code. So I could just add in an extra line saying to contact your local FSS member, and we could either have it to go to URL or have it just have them email the Survey Sparrow or the New York State Advocacy, or however Chris has the email listed.
Okay, so do we have any, does everybody agree that we'll go that route? I think we will have further discussion on how it's going to work, but for right now, can the brochure and put the line down and figure out how we're going to have people contact the FSS Council, learn more about their FSS Council. So in Buffalo, any objections?
Hold on, I think there needs to be just a little more disclaimer. I think we need a little bit more verbiage because it's going to be asking people about their status. I'm sorry, I had my hand raised. I know you probably can't see me.
I was ignoring you.
Thanks, Kathy. There just needs to be the right language around the QR code if it's something that we're going to include. So I would propose that if it's something that we want to move forward with, that we have a small group working on how that reads, because there might be disgruntled families, there might be happy families, that's all great, but then to put us underneath that, we don't want the message to get lost. So we would just need to make sure that the verbiage was very clear about what the purpose was. Does that make sense?
Yes, good point. Thanks, Gail. So we will then move forward with this mini project, and be reaching out to a few of you to assist on that verbiage. All good?
All right, so back to data sharing. So like I said, this is what we are committing to sharing at a minimum. But what we'd like to understand is what is missing from this list. And what I heard from Scott when we were talking about the site visit protocol is anything related to reoccurring issues. So if there's any historical info on a site visit, that you all would want to have access to that to be able to study before going into another site visit, which is totally logical. I think we can kind of bucket that into the site visit protocol prep specifically. Is there anything on this list that is missing? Is there anything that needs to be added to this list? This is what we think we've been hearing, but just wanted to confirm with you all. Never been so excited to hear silence.
It's kind of vague, broad, provide data to include milestone, provide data. That's just. So it includes how much the contract is for. Oh, over this. Okay, then it's covered behind it.
All right, we've got the basics covered. Anything else?
Just comment. This is great, and I think you're right, it's broad. One of the things that we should do is, and I don't think we do well, is to, in a year, after we release whatever we're gonna use, revisit it and ask if it's working. And be able to make some rapid change. Instead of waiting and saying, oh, we're working on it, just make minor changes if it's not working, which is something we don't do well. But I would just say, let's put it down on the calendar and say within a year, let's do a review. Is it working? Is it not working? And it's not for attack purposes. We all are interested in making sure that whatever we get is valuable, useful, right? So just a recommendation.
Yeah, absolutely. I think, we're rolling this out first quarter of next year. We're rolling out the updated site visit protocol. So, a year from both of those packages kind of rolling out, I think in a year tops would be a great time to revisit, but we can also have this raised on quarterly meetings even after you start receiving anything, I think it's good to let things kind of fall into play and use it over time and see how it's impacting, but it's never too soon for you to kind of come back to us at this table and let us know what's working or what's not. And you also don't have to wait until this meeting to let us know that either.
Chris have his hand up?
Yeah, hi, everyone. One of the pieces of information that I thought was incredibly helpful, especially when recruiting new members, were, I believe, what you call the annual reviews. These are the documents that we reviewed during the annual review process, where we see the program, the size of the program, the units served, what we're supposed to be doing, how it's going, the problems we're facing, how we're managing it, all that good information. So it would be amazing, I think, if we could get at least for our own local councils, a PDF of all of those annual reviews, so that we can, as we have time, begin to get a little bit deeper understanding of the programs in our area. And also it will, again, be a great educational tool for bringing in new members and really trying to bring them up to speed about what these programs are all about in an incredibly, I think, efficient manner. Thanks.
Chris, can you clarify that? I'm not sure I understood exactly what you're asking for prior to.
So when I attended annual reviews, we started each review with a document. It looked like that program's annual review document. It describes the program, what the value of the contract is, the units they're supposed to be serving. It talks about how their program is, the document, everybody knows this document, right? We sat through the annual reviews.
Okay.
Yeah.
Yes. Yes.
I don't know. That's the document we started with in Region 1, right? I think you call it interview.
That makes sense, Chris. We will add that for a future topic. I personally need to just see what that looks like because I haven't seen one yet. Other people are nodding their heads in the room and think that makes total sense. So thanks for flagging that.
Awesome. Thank you.
Any other questions? Mary?
Hi, Kathy, thank you. I just wanted to ask, when you talk about provider sharing data on certain things in the contract, I also want to know if we can clarify what FSS, our local district, regional office is supposed to share with us. For example, I wanted to know what was being denied in family reimbursement, and I was told to ask Courtney. And I don't know who to ask when I ask for some data of what's being denied. So if we can just look at that as an explanation of what we're entitled to get from our regional office or where we have to go to.
I mean, maybe we can talk about that separately, but I think that's a fair question. Thanks.
I think we're going to move right up. 12:37. How about we try and stay on track a little bit so that comment period happens when it's supposed to. So how about we can get back about 1:05? Does that work? Okay, so let's end this part of the meeting, and at 1:05 we will resume once again. Thank you, everybody. Okay, we're back. And we're ready to start. So we're gonna start listening to we're now going to begin with, I'm sorry. We have something wrong here.
To become a panelist.
Yes.
The
My apologies. Okay, so.
Oh, it's Mary. Okay, you're good now.
Oh, I apologize. So we will now begin, subcommittee reports, first with Mary Fasano and Bylaws. She's going to talk also about the, statewide bylaw changes as well as.
It's gonna be short, this short and sweet. Fortunately, the local bylaws have all, with one exception, been sent to Albany and gone over with a fine tooth comb as they're wont to do. And things have gone back to the local for all the corrections. The only exception is Queens, who has not submitted their bylaws, so they're out of compliance. But congratulations to the rest of you. You've done a great job. Secondly, the statewide committee met in, I think it was October we met, to amend the statewide bylaws, which is in accordance with the bylaws. The first amendment that we proposed and agreed upon was to substitute the name Statewide Family Support Services Committee to be in compliance with the legislative name of our group, which is the Committee on Family Support Services. So therefore, every member of the committee received those changes as to comply with the provisions of the bylaws, that they would have received them, and within 30 days we would vote on them, and that's been done. And the other change to the statewide bylaws was to eliminate the sentence under the meetings of the statewide committee where it said frequent absences may be addressed at the local level. What was substituted was and approved more than 2 consecutive absences unless due to extraordinary circumstances, will be cause for removal from the Committee on Family Support Services by vote of the members of the committee. Substitute, or then that is the other change that was voted upon and approved by the statewide group. That's my report.
Thanks, Mary. I just also want to remind all our statewide members that January 1st is rolling around. And in that month, we should have updated conflict of interest for every member. It's an annual update. Changes do happen, so we want to ensure that when the changes were made during the course of the year, it's all official January 1st, January 2025. You have a question?
Who do we send them to?
Conflict of interest. Are you asking me who we send them to?
No, I was asking here in the room, they trying to figure it out.
We will figure it out in 1 second.
Well, you know, my gut reaction is that they should be kept on at the local level, because that's, you know, where it's affected. So the local level should be responsible for updated COIs.
Yes, well, that's definitely, they should be included, but we also want our FSS staff to know, because, you know, they need to know as on the councils too, so. Amy, I think we had been sent to the shared regional field office email addresses too, as like an FYI. So can we continue doing it that way? Unless there's any objections.
If it is not broken, as they say, if it's, you know, we don't need to fix it.
Okay.
Okay.
You can send those around, and they're also at the end of the presentation too. But share those again. Thanks.
Okay, thank you.
Mary?
What, yes?
Would you want each statewide member responsible for sending their local councils to that? Or do you want it sent to you and you send it up?
Say that again, Kathy.
Excuse me?
Repeat that. The audio is not the best. Go ahead, repeat that, please.
Would you mind receiving all those COIs again and send it to that particular email? Or is your preference that each statewide member collect their local councils and send it up?
Let me get back to you on that one, okay? Let me get back to you on that one, please.
Okay, sounds perfect.
All right.
Thank you, Mary. Scott, do you have an advocacy update?
Yeah, a quick one. Yes, a quick update. So I was hoping that we have a pre-meeting where we usually discuss the agenda, talk about this before, but I'll just briefly outline what the advocacy group talked about. It goes in line with what we were talking about with getting family surveys and how we think about services. And we talked in the last meeting, by the way, we have a very active group. Seems like it's full attendance almost every meeting, and it goes over. So the last time we discussed how do we get family members to use the public comment period better. And you know, the reason is, you know, we sometimes leave early, right? We end early. The follow-up, I'm not sure what the follow-up is, and somebody does a comment, I don't know what the follow-up is. I should know, we were in the meetings, right? So those are two things that we talked about a lot. And then how do you remedy it? One of the things that we talked about is moving the public comment period to a time certain. Maybe between the OPWDD reports and our committee reports. So it's not at the end, it's not an afterthought. And then doing something to follow up. Let me just see if I have everything. So the other thing, it would reiterate the importance of having families talk. We all try and do the best we can to represent families, but I really think that we need to engage them better. So I did send out an email, Kathy and Gail, to the whole committee, hoping that that would foster a conversation at our, other than this meeting, before this meeting, so we could have some kind of agreement or not on how to structure this better so that we could hear families. So that's my update. I don't know if anybody on my committee wants to add anything, but I think it is very important that we start to pay more attention to families. We paid a lot of attention to how we review programs, the data issues, the pay issue, but what's missing is family involvement in their participation in this public meeting. Anybody in the community want to add anything? So we should talk about that at our next meeting.
And we can have a conversation in January about that.
And Scott, I just wanted to respond to the question about follow-up. So we know it can be a bit awkward, right? Where we say it's public comment, we can't respond. And that can be painstakingly awkward at times, and just such a clear need for follow-up. So what we actually do behind the scenes is when somebody is presenting an issue, we reach out to get their contact information, and the regional field office follows up with the person that's speaking. So if there is, any way that we can continue to ensure that one of us is getting that person's contact information to be able to follow up after, that's what we've been doing so far. But if there are other ideas, totally open to that. And also just about the timing of the public comment, it's meant to be at the end of the meeting for people to be responding to what was presented. So.
Yeah, so that's why I said after the OPWDD presentation. So yes, and we're thinking outside the box because since I've been part of this group, the participation of the public is waning. Why is that? So that's what we were talking about. The other thing too, I think it would be helpful then if there is follow-up, that maybe in the next meeting, that's an agenda item that maybe we can get an idea of what was followed up on. What were the issues that you were able to follow up on, resolve or not?
Yeah, I think if the committee wants to kind of flag common themes and areas that were raised through public comment, and they would like a formal kind of update from OPWDD, that's something we can factor into the agenda. I think we're receptive. I think we should just talk about it a bit more so that we're organized.
I agree.
Thank you, Scott. Okay, reimbursement ADM. Deb is our chair, but there were a number of people who joined this work group, we call it the CGTAC work group, because as Alexis said, there was what we've heard of, that's one of the things we did here in public comment actually, that was thought that we need to figure something out, something that's not working for everyone. And we met on 2 occasions. Aviva was able to join us at both of them. We had Chad and Nick, Amy, and Alexis with us as well. And I had sent you all and the piece of the ADM that we addressed. It was on the eligibility for family support services. And in that eligibility definition, this isn't exact, but it's for all people who live at home with 1 or more non-paid caregivers. That person is the ones we are talking about, families that child receives OPWDD services, and that parent is providing the CTPAP for that their own child. And by excluding them, family reimbursement, it impacts the families in many ways. And we couldn't understand, like, why would these families, and many of them the most in need families, they're doing the CDPAP in many cases because they had no workers. They had workers they wouldn't have to do it. And it's usually families that have children who have multiple disabilities, who are truly like 100% dependent on a caregiver or child with high behavioral needs. So what we ended up agreeing on, and the committee had, I don't see you with that.
Hi, Kathy, it's Debbie. Can you, did you ask me to say something? We didn't hear you completely.
Do you remember who was at the meeting?
Yes.
All right, great.
Myself, you, Gail, Crystal Vossler, Chris P, and Alexis.
I went through all the state. I did the state.
Yeah, I think I got them all.
And what we agreed to propose to the entire statewide was that we amend that to allowing CDPAP caregivers to receive goods and services up to $3,000. Food is not included, but goods and services are. And what I'd like to do is see if we all can agree on that so that that change can be made. Do you have any? We have
Kathy, before I do anything else, because you're going to ask for a vote, I want you to be aware. I did text this to you as well as Gail. Mary Fasano had to leave early. She's not well. I want you to be aware that she's not here now.
Okay, thank you. Thank you.
So that's what I wanted to first bring up first. Also, I'd like to bring one point up that I would like the other members to know who were not at this meeting. If you are the CDPAP, if you are the rep payee for your child, you may not be paid to do CDPAP. One problem is that there are a lot of women, and I'm going to say women because it's mostly women who take care of their children without the child's father, and they have to either choose to be, and they always don't have enough family members, so they cannot receive CDPAP, even though it would be helpful to them, because they have no one else they feel they can trust to be the rep payee. Now that leaves out a lot of families who cannot participate in the CDPAP program. That's just one thing. It is not an OPWDD ruling. It is from the people who run the CDPAP, not OPWDD. And I also think OPWDD was very gracious to allow for goods and services for reimbursement.
Thank you for pointing that out, Deb.
And thank you for explaining also what was done at the meeting. Thank you.
And Crystal, I see your hand up.
Yes, my hand was up for the topic for the public comment section. I was trying to add to that conversation, just because me and one other chairperson had discussed that we would like to recommend having public comment moved up, maybe even towards the very beginning of the meeting. That way, we can hear what their comments are. And if we want to, as chairpersons, want to address those comments or add that to our conversations for the meeting, we could, and it would allow OPWDD to respond to them directly at that time. So there's, it would allow people to have better interaction during meetings, because we want to increase the number of people doing public comment, and we want to increase the number of people who are invested and interested in the meeting. And I think by leaving public comment at the end, it leaves them feeling empty and unfulfilled over the discussion that has been had, because they're just left by the wayside. And so we had talked about it, and we feel that we need to have public comment moved up higher during the meeting, so we can all be informed of issues, because these are issues that might be affecting their family, but thousands of others that we are serving, they're having these issues too. So we feel that we should have that moved up. And also, I can't believe that rep payees cannot receive CDPAP. That actually angers me, because there are people who need these services, but they also have nobody else that they can rely on as a rep payee, because some agencies are very stingy about what can be released. Some people will say they're a person only allowed to have $20 spending for the entire month, when there's need for a new toaster and things like that. So knowing that a rep payee cannot receive CDPAP, which is a very needed service, personally makes me upset. So I just thought I'd mention that too.
Thank you, Crystal. And that is one of the things you may want to discuss when we have our meeting next month. All of these ideas we'll talk about and come up with some kind of recommendation. As far as the second one, I please don't want to mix or confuse our participants today, but the CDPAP that Ted and Crystal just talked about, it's not an OPW decision, it's under the Department of Health, and people are outraged by it. I feel it should be working with the Department of Health on this. But thank you. Chris, your hand is up.
Yes, thanks. Can you guys hear me? Hello?
Yes.
You can hear me all right?
Yeah.
Great, thanks. Thanks so much. If I could just take a minute, this has been one of the marquee items of my advocacy for the past couple of years, and I am absolutely thrilled to see that we're making some movement on it. This is good news for the community and good news for these families. I understand the policy was implemented in an attempt to achieve equity and to assure that services are getting to those most in need, including families without income resources. And of course, this is a very necessary endeavor. While I'm glad to know that a repeal of this exclusion for goods and services reimbursement is now being considered, I and others remain concerned that it looks like some families who are facing really difficult challenges will remain disqualified from participating in FSS respite reimbursement. I'm grateful for OPWDD's commitment to data-driven decision-making that's more informed by those who use the services. So I've asked for a summary of the data and lived experiences that were relied on to support the belief that this exclusion would meaningfully enhance equity. I've asked for a summary of the data and lived experiences that enhance our understanding of how well this policy change has achieved its intentions, and perhaps most importantly for today's discussion, I've asked how data-driven decision-making continues to be employed during the implementation and evaluation of this policy. While the questions remain unanswered and while they seem beyond the scope of today's discussion, I do have two questions that I'd like to ask for my and the public's clarification. I'm hoping that someone can help me and the public understand the rationale for not including respite services, and if possible, an understanding of any data and user experience that's being relied on. And the other thing I wanted to put out there is that in 2023, Monroe County had about $865,000 available for family reimbursement, but only a third of those funds were utilized, leaving well over $500,000 on the table. That's Monroe County alone, and it seems that this underutilization is widespread. So with what appears to be more than ample funding currently available, can we get an understanding of why we are not also considering a reinstatement of access to FSS respite reimbursement for these historic families? Thank you very much for the time.
So Chris, hi, this is Abiba Kindo. Just on the point of the respite exclusion, So respite is relief to an unpaid caregiver, right? Because they're supporting their loved ones, right? And so when you start to authorize respite for a paid caregiver, it's no longer relief, right? Because that person is being paid to support their loved one. So that's the rationale behind the respite specific exclusion, because it is relief to an unpaid caregiver. And that's the formal definition of what respite is. And I know that we've had these discussions before, and that was previously explained as well.
Yes, I know we've gone back and forth on it quite a few times, and I guess where I'm always stuck again is the definition that we're using for paid caregiver. When people are being paid to provide services that DOH believes serves the interest of that family and the agency, it's hard for me to then take that quote unquote payment and apply that as if OPWD were also providing some relief here, right? And so I guess that's my point to it. And if there are other rationales, I would love to hear those. And again, thank you for the time. Appreciate it.
Is someone talking? I don't hear them.
We don't hear anything.
And
Yeah, we're not hearing anything.
Okay, we're sorry. We were muted. Brooklyn, did you put your hand up or
yes,
comment?
yes. Okay, yes, we have our hand up. Chris, thank you for that information that I asked you for months to give me about how much money is being used or not used in the reimbursement in your region. And I know you're concerned about the CDPAP parents, but I'm more concerned and worried about parents who can't get CDPAP, who need the reimbursement, and that to me is far more important. So I'd appreciate in the future when I ask you to send me some information in your area, and I appreciate you would. I tried to cooperate and work with you, but I'd like the same thing done to me.
Thank you.
Thank you.
Okay, and Crystal, your hand is up?
Yes, it's Abiba said that people who are paid caregivers do not deserve, was basically the way I heard it, a break.
I don't think that's what she said, Crystal.
Yeah,
I'm sorry to
That's how it
interrupt. It was-
translated to me.
Yeah, that's not what I said, Crystal. This is not, my comments were not about deserving. I just want to be clear. I understand that there are policies in place that we don't agree on. But I just also want to be very careful about the words that we choose, because there are individuals and families listening, and I don't want anyone walking away from this meeting feeling as if I or my team members feel that they're not deserving of something. What I simply tried to do was clarify what respite is, right? Respite as a service is intended to provide relief to an unpaid caregiver. It is not a habilitation service. And so in my attempt to respond to Chris's comments, I was simply clarifying what respite is. And that's why respite reimbursement was excluded from those caregivers that are paid to provide supports to their loved one. But I never said that paid caregivers are not deserving of relief. So I just want to be clear about that.
Thank you for the clarification, because that's how it computed to me, because I know that parents, even though they're considered paid caregivers, they are stuck at home nonstop having to care for someone without any kind of break or relief. So not allowing them respite is basically saying that, you know, they, I hate to use the word deserve, but they don't deserve a break because they are being paid for the caregiving, but they need a break. They deserve it, in my opinion. And I feel that it's something that's being overlooked because I don't know if anybody here cares for a child 24/7, but it's exhausting and it's difficult. And even if you're getting paid to take care for someone like that, you need that break. Thank you.
Thank you for your comments, Crystal.
Thank you. Thank you, everyone, for your very important input. I would just like to say that I believe, like Chris, like I said, he's happy with what we agreed upon with his comments about respite. So I'd like to just put it out there for a vote that for today, first of all, you know, sometimes when we talk about central office, they're not listening. They did listen, and we have to really celebrate those small gains. We do. They listened, they compromised, and we didn't get everything based on what Aviva spoke about, but we did get those goods and services. And there are some families that will definitely now open the door with that benefit from that. So, unless we have any objection, please speak now. We will forward this to central office and they will start putting that in action. Everybody good?
I just want you to know, since I'm the only one here from New York City right now, I'm in agreement with it right now, the way it is. I'm fine.
Okay. Okay.
So thank you guys so much for bringing this recommendation. What we will do is just discuss at OPWDD next steps to how we can implement that. Just really, again, appreciate the solution-oriented and productive conversation. I know it's been a few years that we've been discussing this, so I just appreciate everyone's time and attention. And we will definitely continue the conversation.
Thank you. Okay. We have a couple of things from community engagement, and we'll start off, I believe, Crystal, you're reporting on community engagement?
That's correct. So as you know, we have created a couple of brochures, Chris and I have. We've just updated the most recent one that we have for both the print and the email version or digital version. These both have a QR code or a link on them that will direct you to an application to become a member of the committee for your local committee. And this will be sent by Chris. He will send this to the appropriate council for review and for approval for that individual for membership, which I think is excellent that Chris is willing to take on this responsibility because it will be a lot of work having these applications come through. We really want to make sure that we have a copy of the digital brochure on the Family Support Services page for OPWDD's website. We feel it's important that people are able to see the specifics of what the council does and for them to know that what kind of things it would mean for them to become a member of the council. And then they can follow the link to become a member or inquire about becoming a member of the council. And I can make that additional link that we talked about for adding it on for the FSS annual satisfaction survey when that is sent out as well. We would like to have each council have printed versions of the print version of the flyer or brochure that we have. That way they can hand them out at events to increase the number of people in each council. I know personally in our council, we only have members in one of our 3 counties. So that means we don't have a voice for Cattaraugus and Chautauqua County of people who actually live in those counties. But we are the closest to represent them. And we would like to be able to recruit people from obviously Allegheny County as well, but we'd want to be able to get people in those 2 counties so they can represent individuals that are their family and in their communities. And I would like for other counties or other councils to be able to do this as well. That way we can make sure that there's someone representing for each of the counties throughout New York State. And I think that's all I have. Is there any questions?
Thank you, Crystal. So what we will do, I think I talked to Crystal yesterday, is, Crystal, did you send out the brochures to everybody last night?
I did. I sent them out so everybody could see them. That way, if we do a vote today about utilizing them, that they'd have opportunity to preview it.
Okay. 1 minute, New York City. So what I'm thinking is that we should give everyone a chance to look at the brochure at home, okay? Because there's the digital version and the hard copy version are identical with the exception of the link on the digital one that's proposed to go on the website. When you click on the link and you get the person to fill out the application, that application will then be submitted and received by Chris Palega. Thank you, Chris, for offering to manage those emails that you're going to be getting. And that same exact brochure is going to have that QR code. And if somebody out in the public gets it at a fair, they could scan it, and they also will have the same exact application to fill out, and it will go to Chris. I personally didn't have an opportunity to look at the application. I know that the team from the Community Engagement Subcommittee worked on it. I would like to look at it. I'm sure everybody else would like to look at it. And, you know, maybe what we can do, Crystal, is give people, do you think 2 weeks is enough time to look and review and get back to the comments?
Thank you.
Yeah, I think that could work.
Yeah, and I can send out the link to that application, Kathy. It's the one we used during the survey recruitment when we had such response and we were trying to get people qualified. So I can share that after the meeting with everyone.
Perfect, thank you. And I see New York City, you have your hand up?
Yes, I do. First, I want Crystal. I looked at the brochure and I was very pleased I could bring it up on the phone. It's very well done, very nice and colorful. And I will be voting in favor of this because I do like it, but we will, the rest of the committee does, we do have to discuss it, but I want you to know, I can only talk to me. I just want you to know, if you heard before, Mary Pisano did leave early. She's not well. So here with me, I'm happy with it.
Thank you.
You're welcome.
This is a lot of work. I think it's gonna be a great recruitment tool, and I appreciate all you've done, Crystal, and everything Chris has done. And going forward with Chris getting that information and passing it out to the contact. I don't know if people listed their chairs or their statewide members themselves, but we'll double check on that as well when we get closer to posting. Okay, the next thing we had talked about last meeting, I think we talked about two things. The council bylaws and the statewide bylaws going on the website. And we did have, Bill and I did have a pre-conversation with central office. And I'd like to just hand this over to Alexis so she can talk a little bit about why we think the local councils might be more difficult. There's changes, there's, how to manage that, keep it updated, that maybe Bill, you're there, I see you, maybe you could talk a little bit about it, because there was a couple of things that we spoke about, just putting the statewide rather than all 17, how many councils we have.
I think the thought was that it would changes would be hard to continually maintain updated for every single council. It's a lot to put on a website when many of them are very, very similar.
So we'd like to recommend that we do put the statewide bylaws up there. That would be much easier to manage. How do people feel about that? Do we have everyone in favor of putting the statewide bylaws on?
I say yes for the statewide. I think for the individual councils, I think it would be fairly redundant and unnecessary and a lot of work for the website, but I think it'd be great. So I vote yes for the statewide bylaws.
Okay. And everyone in Albany is a yes.
And New York City is yes.
And Buffalo?
I mean, I think it's a much better user experience to just have the statewide and not have all of that to, try to go through and understand why it's all there.
Okay, and I believe we have a number of remote people. If we have a quorum, then we are allowed to have you vote. Unless any of you object, I will assume you all are yes.
I support it. I support it.
So that goes on the website, thank you. And the last item, the March 23 survey results, that just recently we decided not to propose that at this time, so we don't have to discuss that at this moment. Which brings us and our update. So we're finishing early. What we'd like to do is go forward with public comment now, because we have people here now. But be back here, still be here at 2:25 in case people looked at this agenda beforehand and stepped out and want to come back at 2:25 to give their public comment. Are we okay with that?
Let's go up. No.
Well, or we can wait till 2:25. Those are the options.
Buffalo would like to proceed.
I think in New York City, I have three people from the public who would like to speak. So when you're ready, let us know.
Okay, Buffalo, did you all agree to proceed?
Yes. Yes.
Okay. And here we do. Okay, so at this time, we will hear public comments. So we will hear public comments at this time, and please remember, we ask you to limit to 3 minutes, and because of the process, public comments are not, we do not respond to that. We will keep notes to see if there's a theme, a concern, and have agreed to look at that afterwards. So is there anybody, we'll start with Albany. Anybody here who'd like to speak? Okay.
Okay, so if nobody in this room is going to speak, we can, move on to, New York City.
This is Chris, we have 3 speakers. The first one, gentlemen, can you stand? And Mike, can you switch to the seat so he can sit? Huh? Because they gotta hear you. Yeah. They gotta hear you.
They can't hear you over there.
Yeah. The gentleman is coming, please give us a second, because we want to make sure he hears you.
Where's my phone?
Right over here, sir, the seat.
Give him his name for them.
Yeah, he's gonna.
My name is Ephraim Grossbein, and I'm getting back in self-direction because I was out of the state and the country, so now I'm getting connecting with self-direction again. And I wanted to know 2 things. One, what is the self-direction overview that I saw on the flyer for New York City Fair? And the other one is with the increase with raises of direct support staff. What is that going to be?
They can hear you.
Thank you for your comment. Just a reminder, we won't be answering questions during the comment period. But we appreciate your comment. Thank you. Okay, are there more folks in New York City?
Yes, yes, we have another one coming. We just have this one gentleman's got to switch seats. And then the last one. Yeah. Please state your name.
My name is Loretta Coleman from Queens, New York. I'm a Tier 4 representative. My brother was in Willowbrook. And what I need to know now is in terms of gerontology services, because our Willowbrook Tier 4 clients are the oldest members of OPWDD. I guess we have the biggest legacy and the biggest history. So I'm concerned about the gerontology services since they're being told that they have to age out in the community, not in nursing homes. So there needs to be a greater effort for gerontology services. Thank you.
Thank you.
Thank you.
Thank you for your comment.
Yes, I'm the last speaker. This is Christopher D. Greif. Just to say one happy holidays to all from all around the New York State region. First, I want to say that as a person with a disability advocating, first, I want to thank OPWDD putting on the newsletter about the PATH trains. As you know, that disability will now soon by 2025 during the 8835, we'll be getting a chance to use the PATH train for reduced fare for people with disabilities. So I want to make sure OPWD, thank you. Lexus, thank you. I know I can see you from the screen, as well as Aviva and everyone. One thing like I hope to see in the near future to everyone is educating our staffs and families how to work together. And I have seen that very much for the last year. And as you know that we are still continuing advocating to make sure that everyone gets the right stuff and the good stuff and the interesting stuff, we need to remember that all New York regions, we have to work together as one and work as a team. We might not like each other, but we still have to continue advocating for wherever we are in New York, wherever who we are, what we are, and what we do. So can we please continue doing that and always keep communication, a lot of newsletters, a lot of things to work together as one. As an advocate for a person with disability for over 31 years, I have seen a lot of things change, a lot of things good changes, but the thing is facts needs to come out. Information always needs to be shared, and how can we work together? What I have seen for the last years is people are working together. But what I don't see is
When we are supposed to follow rules and regulations, we need to do that. The rules are there for a reason. The ADA compliance is there for a reason, and we still need to continue doing that from now to the next year. Thank you, everyone. Happy holidays to all, and all a great day. Thank you. This is the last speaker from New York City.
Thank you very much for your comment. So next we'll move over to Buffalo. Is there anybody in Buffalo that would like to make a public comment?
Yes, I thought about today. The woman doesn't want to do it. You said, oh, she's not here. She's not here. Oh, she'll do it. Doing it, no. There, see. No, we're good.
Okay, so no comment from Buffalo?
No.
Okay. All right, so next we can move to online public comment. If you are online and would like to make a public comment, you could raise your hand, click on the raise hand icon.
If someone's talking, I don't hear them, but I do have my hand raised, by the way.
Okay, if there's no one else online with public comment, we can move back to the members.
Alexis, this is Kim, the interpreter. I noticed that Crystal said she has her hand raised and she wanted to speak. I don't know if that's a member or how that's working, but I'm just letting you know.
Thank you. We actually do have somebody online with their hand raised. So John M., I just sent you a request to unmute. Okay, you're unmuted. Go ahead, John. And just a reminder to folks online, we would like to limit comments to 3 minutes. John, go ahead.
You can hear me, right? This thing, I want to make sure my connection's kind of fading in and out. But anyway, very good meeting. I thought it was pretty productive. I also, too, I kind of got in the middle, so I missed a lot of the beginning stuff, but I heard some stuff which kind of spoke out. That part about, I heard someone bring up about trying to recruit members or something. Which is funny because I actually, Woody McCall brought that up at multiple meetings, how I would like, I'm open to joining one of the committees. One of them is the self-direction committee. I'm really open to that. I don't know if they're here right now. Also to the, any other, maybe, I don't even know what that committee is called or if there is one, but where they look over reports and stuff. I've been very interested in that to see how, certain complaints or stuff go on or problems, concerns, because I get a lot of that on my end. And sometimes, it's good to, if you want to fix things, sometimes it's good to get right up there, where the where things get handled and stuff. And I don't know, I think I'd be a good asset for that. I experienced a lot of things, that, the worst life has to offer. I don't know the best way to word that, things that probably are not even brought up at these meetings mostly, but I would be very open to join some of those committees. I think I have a lot to offer. Also, too, the other thing is I heard something brought up about counties or getting members in certain counties. I think my county is one of those ones I wanted to point out, really important that, because as you probably see, I'm not really part of any group or anything because my county doesn't have, no one in my county goes to these kind of meetings. Very few. I don't even think half of them know these meetings exist. I tried to get a fellow, what was it, earlier to join this, but he had technical difficulties and he just actually had to go to work. But yes, I think maybe some of the counties, they need to be, to know these things go on and, things that go, I think it would be good, my county including these, my counties. I don't know if you want my county's information. I don't know, through the comments or here, but I would like to see more, this stuff in my county. But yeah, so and I hope that helps. I'm open for to join one of these committees. I don't know what you have to do for that, and maybe bring some stuff to my county as well. Thanks.
Thank you for your comment, John.
It would help to know what county John was in.
Okay, I don't see anybody else with their hand raised. Again, just a reminder, if anybody would like to make a public comment online, just click the raise hand icon next to your name. If you hover over it, you can raise your hand. Crystal, I believe you, hi Crystal, I believe you had your hand raised before. Go ahead.
Yes, thank you. Also for John, we'd love to know what county he's in, or if someone could connect with him, that would be great. But this is a public comment for myself, not as a representative. I was in a meeting just yesterday with some direct support workers, and there was staff there, there were supervisors as well. And they had mentioned that since 2019, there have been 30 to 39% increases in inflation or CPI. For instance, mental health, they've received 35% increase to accommodate that. But for developmental disabilities, it's 4% for group housing. And if you think about the costs that individual group homes have, they have the cost of electricity and the cost of like vehicles and basically anything to maintain it. If we're only giving a 4% increase to these houses when there's a 30 to 39% increase in inflation or CPI, then this in turn sets a stage for the next Willowbrook. So for a personal comment, I think that's pretty upsetting. And then the other thing that I wanted to mention is that I would qualify for CDPAP. It's quite common at 3 o'clock in the morning, I am upstairs scrubbing feces out of carpet to make sure everything's hygienic, because it's easier to slide down a set of stairs with carpeting to clean your rear end than it is to wipe it. And when you have a child who's profoundly autistic like I do, I mean, I'm sitting there crying and scrubbing feces out of the carpet 3 o'clock in the morning. And knowing that if that was my only income source and having to take care of a child like that, and not having any other way for respite, knowing a situation like that is devastating, because there's so many things where you're just constantly having to do to take care for an individual who is profoundly autistic or have profound medical needs and have a developmental disability. Because our children, like my son in particular, he is always going to be a 2-year-old. He's 6'2" and a 2-year-old. And we're always going to have to constantly be scrubbing feces out of a carpet or circumstances like that. There's always those high needs and high attention that's required. So for my own personal comments, I just want to say, I feel that someone like me, if I had CDPAP, I feel like I should be allotted respite. I should be allowed a break because personally, it is extraordinarily difficult to take care of someone 24/7. Thank you.
Thank you, Crystal. Okay, I still don't see any hand raised online. And again, if you would like to make a public comment online, just click on the raise your hand icon and we will let you speak. Okay, I just saw a hand raised. Diane Fraser Smith, I believe your hand was raised. Okay, Diane, I'm gonna send you a request to unmute. Okay, you're unmuted. Go ahead, Diane.
I just have a comment on the ADM and as far as the reimbursement. I know they were talking about having something put together where the families would know exactly how this procedure works and how we can better help them to understand what they can get and what they cannot get off the family reimbursement.
Thank you for your comment, Diane. Diane, if you could share your contact information with the panelists or myself, Alexis Harrington, that would be great. Thank you.
Well, that was the final public comment. So I'm asking the committee members if we should end this meeting now, or if we want to sit here till 2:25 to see if anyone signs on. Anybody here have an opinion in open?
Now, we're on the same. It's a.
Buffalo says end it now.
If I recall, the meeting, one of the top numbers of attendees was total 147. I believe that included the panelists. And when we started, we were down at least 20 people, 25 people. So if anyone dropped out, they knew we were ahead.
Good for us.
I'm thinking I'm in favor of ending it. Although we have mixed feelings here in Oldham. But New York City, do you have any objections?
Please repeat that again.
Kathy, I didn't hear what you said. Can you repeat?
Sure. Would you like to end the meeting now? Or would you like to hold on until 2:25, as we stated, that's what public comment would be?
Sure, I could do that because I'm giving one of the persons who are in the room, they're contacting Accessorites to see if they can move up their pickup. So I'll need like 5-10 minutes for them. Thank you. I mean, if I have to go to another room, I could, if I had to.
I'm sorry, Deb, I didn't hear you. I think you have to get closer to the mic.
Speak up.
Okay, what I'm saying is I can wait till 2:25 because one of the participants here is calling Accessory to see if they'll get them earlier. So, I'm fine ending the meeting now, or whatever time. Mute me.
Are you talking about someone who already spoke?
Yes. They're not members of the statewide like I am. So we're going to complete exec session.
Okay, and Buffalo?
Yeah, go ahead.
So in Buffalo, we are good with ending the meeting now.
Okay. So we're going to end the meeting now, or I think we have a closing remarks, and then we'll end. We have a slides on.
Still at half an hour.
It's on, so.
Okay, so we could go to the dates first. These are the dates that central office has proposed to meet for the upcoming year. See that we only have 3 instead of 4. Within that calendar year, we normally have it each quarter. Is there a reason why we're only doing 3?
Yes, so this is Alexis. So we are actually coordinating these dates with the larger DDAC as well. So one of the reasons why we were shifting this calendar schedule is A, to kind of get us out of the holiday season, B, to align with the budget and fiscal year to better inform planning. And if needed, they're also working to improve some of the logistics of the rooms. So that's something that Rachel's team is also working on. So that's just kind of the rationale. I'm not sure if anybody has any questions about that, but we did want to just flag for you that one of those days is a Thursday and we do typically meet on Wednesday. So just throwing that out there as an FYI, we'll keep you all posted if any of those dates and times change. But this is what we have secured so far, and we will keep you all posted on the January 2026 date and time.
Any questions from the committee?
I would tend to think that because of the RFP that's supposed to be coming out in the spring of 25, it might be prudent to have a fourth meeting around the RFP.
I have my hand up for the same reason.
Jan, we will have separate meetings, trainings and conversations between now and when the RFP is going to be into us for review, which is in the first quarter of the calendar year.
Thank you.
Marie, you have your hand raised?
Yeah, it was for the same reason. I really feel that there should be a meeting in first quarter. Again, because of the timing of the RFP. By the time we have the quarterly meeting, it'll already be April and we'll be well into it.
We'll be well into it, but we will be well trained and informed.
Well, I don't mean us about necessarily being well trained and informed, but the community at large will not have heard a quarterly update until we're well into it, is my point.
Mary?
I actually agree. I actually like the months of March, June, September, and December. I think March is important because of the budget coming out. I think June is important other than July because of the summer month. And I think we meet early enough in December that we can say the holiday is not interfering with this meeting. I think.
Thanks for that feedback. Rachel, I see you're on. I don't know if you wanted to say anything now or if we wanted to discuss at a later time. It looks like you unmuted yourself, but we couldn't hear you. If you're talking, you're very quiet.
I'm trying.
We can kind of hear you now. Rachel is changing her audio. Before we know it, it'll be 2:25, so our question about staying on for public comment will be totally moot.
Hey, can you guys hear me now?
Yes.
Okay. What I said was, this is all really helpful feedback. I don't have anything immediately to say at this meeting today, but I'll take it back and chat with some folks internally and connect with Alexis, and we'll get back to you all pretty quickly with thoughts.
Thank you very much, Rachel. And we have, I believe, New York City, your hands up.
Hi, okay. I don't mind Wednesday, April 9th. I'm not too thrilled about July 23rd because that is the 35th celebration for the ADA, and that's going to be hard to try to coordinate. And after from July to November, that's a long time, not to me. So that's what I would like to say.
That's
Thanks,
really
Deb.
helpful on the ADA anniversary, for sure. I would say the reason there's a gap from July to November is just because of room availability. It's supposed to be October, but we were struggling getting room availability, but that's a really good flag on the ADA anniversary, so thank you.
You're welcome.
Okay, so we will hear back from Alexis after she has an internal conversation. Thank you, everybody, for giving your opinion. You know it's gonna be strong, and I appreciate that. I'm sure Gail does too. So, with that, I want to thank everyone for joining us today. We did get a lot of work done in the last quarter, and thank you for all those that have worked on the different subcommittees. And we have more to follow up between now and next month. Gail, do we have a date scheduled for January for an internal meeting? You're muted.
Checking right now. I was already in November of 2025, so it takes me a minute to get back to January.
You said something to me?
Does not look like we have anything scheduled as of yet for January.
Okay, so we'll get a date out there soon, and we'll see what the best date works. I think we were hoping to meet on Thursdays. Okay, I just want to wish everybody a very happy holiday. Stay warm. Happy Hanukkah, Merry Christmas, Happy New Year. But Tony, when is Easter? Because if it's in March, Happy Easter. Happy Kwanzaa. Happy everything. Thank you all. Just, Mary says just be happy. Okay, so if those of you who are on this statewide, can you please stay on for a debriefing, and goodbye, everybody.
Thank you.